Hey pharmacists, welcome back. Today we're diving into different roles of hospital pharmacists and how each one contributes uniquely to patient care. Whether you're considering a career as a hospital pharmacist or just curious about what we do, this video is for you. So let's get into it. First up, we have the staff pharmacist. Staff pharmacists are essential to the daily operations of the hospital pharmacy. They are responsible for accurately dispensing medications, verifying prescriptions, and ensuring medications get to patients safely. For example, a staff pharmacist might get an order for an antibiotic to treat a patient with pneumonia. They'll review the order, double check for interactions with patient's current medications, verify the dosage, and then dispense the medication to the nurse. They might also get a call from a nurse on another floor asking about timing or compatibility with other meds. It's a fast-paced role, but also very important to keep everything running smoothly. Next, we have the clinical pharmacist. Clinical pharmacists work closely with doctors and nurses to help optimize medication therapy. They focus more on direct patient care, often rounding with the medical team to make the therapy recommendations. Imagine a clinical pharmacist is rounding with the internal medicine team. They review a heart failure patient's chart and see that their diuretic dose could be adjusted to improve symptoms and avoid issues with potassium levels. The pharmacist suggests this change to the physician and then checks the lab results to make sure everything's on track. After rounds, they'll follow up with the nursing staff to adjust the timing of the medication so that patients are more comfortable. It's all about making sure that each patient's treatment is as effective as possible. Then we have the clinical specialists who are experts in specific areas like transplant, infectious diseases, cardiology, and oncology. They dive into their specialty and provide advanced support to the medical team. Take a transplant pharmacist, for example. These pharmacists work closely with the transplant patients to manage complex medication regimens and prevent organ rejection. Let's say a patient just received a kidney transplant, and the transplant pharmacist would carefully review the patient's immunosuppressive therapy, adjusting dosages based on lab results, and monitor for side effects. If the patient shows signs of kidney toxicity, the transplant pharmacist might recommend lowering the dose of a specific immunosuppressant to protect the kidney. They also educate the patient on what foods and over-the-counter medications to avoid, ensuring their recovery as smooth and safe as possible. It's an incredible, impactful role, helping patients adjust to life with a new organ. Next up is we have a medication therapy management pharmacist or MTM. These pharmacists help patients manage complicated medication regimens, often working with those who have chronic conditions or multiple meds. For example, an MTM pharmacist might meet with a patient who was just discharged with new medications for diabetes, hypertension, and heart disease. During this comprehensive medication review, they spot an interaction between one of the new prescriptions and a supplement the patient is taking. They educate the patient on how to safely take their meds, discuss the side effects, and coordinate with their primary doctor to adjust the dose. It's all about making sure patients can manage their medications safely and effectively. The transitions of care pharmacists or TOC pharmacists, their role is to make sure patients moving between care settings like from hospital to home have a safe and smooth transition with their medications. It's typically like the MTM or responsibility of MTM pharmacists too. Imagine this pharmacist reviewing the medications of a patient about to be discharged after surgery. They check their duplicates, interactions, confusion, and what was taking at home and what they've been prescribed in the hospital. The pharmacist meets with the patient to explain each medication, what it is for, any potential side effects. They even set up a follow-up with the patient's PCP if needed, and this prevents any gaps in care and helps the patient feel confident about managing their meds at home. So that's a look at the different roles of hospital pharmacists, from staff pharmacists who handle the daily operations to clinical specialists like transplant pharmacists who bring advanced expertise to patient care. Each role plays a crucial part in keeping patients safe and healthy. If you enjoyed learning about these roles or want more insights into pharmacy careers, don't forget to like, subscribe, and comment below with any questions. Thanks for watching, and I'll see you next time. Bye.